one of the things that I notice, particularly with women, because of society and culture, we're always holding our stomachs in, right? We walk somewhere, we don't allow that softness in the belly. And what I noticed in practice, I would get men who would have neck issues and shoulder issues, but by and large, the neck and shoulder issues that I would be caring for with my patients were female. And I think that part of that, and I would love your comment on this, is that inability to soften the belly, allow the diaphragmatic sort of expansion. And then when I would ask people to breathe, I would say, take a deep breath in, and they would do something like, so if you're watching on video, you'll see this, and I'll describe it on audio. They would do something like this, like take a deep breath in. So the shoulders would come up. So you're getting all of the accessory like muscles of respiration in the neck. So you're getting the scalenes, the deep neck flexors, the sternocleidomastoid, and then you're getting the traps that are elevating and depressing the shoulders rather than taking a breath through the belly. So there's a couple different questions I have here, but the first is, how are we actually, so you've talked about this softness in the inhale, allowing for a nice long exhale. Can we also think about how to soften the belly a little bit to allow for the diaphragm to actually depress and allow, is there something to that as well, rather than for women in particular, sort of holding the corset, like, trying to hold the tummy in all the time and not allowing for that natural expansion?
I think it's important to start off with the basics. And if you look at a baby breed, or if you look at a young child breed, typically you will see that their lips are together, they're breathing in the neck through the nose, and you will see that they are breathing low. It doesn't have to be an infant. A cat can be a very good example. A cat is lying down on the rug, mouth is closed, and you'll typically see that their breathing is lower. And that's a deep breath. The cat isn't taking a full big breath. In other words, the cat is naturally deep breathing, because the word deep just means far from the top, and deep doesn't mean big. So when people are often told take a deep breath, they often take this, what you described there, a fuller breath or a harder breath into the upper chest, but that's not a deep breath, it's a shallow breath. So when we think about the diaphragm, in the back part of the brainstem, a very primitive part of the brain, it connects the brain to the spinal cord. And housed in that is the respiratory center. And the respiratory center is detecting primarily carbon dioxide and blood pH. They are the primary drivers of breathing. Oxygen to a lesser extent, but oxygen only when oxygen levels drop by about 50%. So in other words, every breath that we are taking right now is not driven by oxygen. It's driven by carbon dioxide. And as carbon dioxide increases a little in the blood and blood pH drops, there's a signal sent from the brain stem to the diaphragm. And the diaphragm breathing muscle moves downwards. And the intercostal muscles, which are the meat between the ribs, pull out. Now, as the diaphragm moves downwards and the intercostal muscles pull out, it increases the volume of the thorax, the chest. And this in turn reduces the pressure inside the chest, which draws air into the lungs. So it's the movement of the diaphragm downwards which is drawing air into the lungs. It's not the air that's coming into the lungs that's pushing down the diaphragm. Now, of course, when the diaphragm moves downwards, you're going to have some movement to your side, some movement to your front, and some movement to your back. So you actually have movement on all 360. And it's really important, because the diaphragm is providing so many different functions. Like every breath that we take, the diaphragm is massaging the internal organs. There's also increased blood back to the heart, lymphatic drainage. So the body's way of getting rid of getting rid of waste, say, from the body. The lymphatic system doesn't have a pump of its own, so it's reliant on the diaphragm. We have the mind-body connection in terms of the diaphragm to the brain, and there's a connection there. We have better gas exchange when we're breathing diaphragmatically. So I think when we have an understanding that the diaphragm and breathing low is really, really important, and even if you're watching your animal, just watch your animal breathe. And dogs, yes, they can mouth breathe, but invariably dogs are mainly nasal breathers. And now we get a sense of, yes, this is where we should be breathing into. Now, I find the best thing to do is to listen to a guided audio for relaxation. I put a few together from my own students 15 years ago, 2010. I started doing one because very often people feel, well, they can't relax. And if you have a guided audio with, say, music and in the background, and it's scripted specifically to bring you down into deep relaxation that you can just let go. And then with that, then there's breathing exercises that you can practice when you're in that relaxation. How do people let go? Now, of course, they could have a manual manipulation. Say, for example, a massage will be one aspect of doing it. Physical therapists can be very well trained in terms of helping to engage the diaphragm. It's not the most pleasant, but it can be very, very useful. But the other thing that I would say is, again, I'm going to come back to going for a walk with your mouth closed. And the reason being is the most accessible and simple thing that anybody can do. If we go for a walk with our mouth closed, we're naturally going to be breathing a bit fuller breaths because we need more air due to the physical exercise and the increased metabolic demands. We're also going to be breathing lower because we're breathing in and out through the nose. We naturally will have a better recruitment of the diaphragm just doing our physical exercise with the mouth closed, and even just bringing a feeling of relaxation to the body as we're doing that. So 3 ways. If I had a client and she's saying that she's a lot of tension, I would go through a little bit of the theory. What is the diaphragm doing? That it is normal that you're going to have a little bit of movement to the front, a little bit of movement to the sides, a little bit of movement to the back. I also say that because sometimes people get confused about belly breathing. And what they do is they put their hand on their belly, just above their navel. And as they breathe in, they're pushing their belly out. And as they breathe out, they're pulling their belly in. That may not be correct though, because you could be pushing and pulling your belly irrespective of your breathing patterns. So what I would like to do with my students is I have them put their hands on their sides. And as they breathe in, I gently ask them to guide their lower ribs outwards. So as they breathe in, can they feel the lower ribs just gently moving out? And as they breathe out, do they feel their lower ribs gently moving in? Because it takes intra-abdominal pressure to push the lower ribs outwards. And that in turn then is a good reflection of the stabilization of the spine. And I'm not sure how many women have lower back pain, but 50% of people with lower back pain have dysfunctional breathing. Now, you could ask, is it the lower back pain which has really messed up their breathing, which is possible, or is it the poor breathing patterns with reduced recruitment of the diaphragm and reduced stabilization of the spine feeding into the lower back pain? But in any event, it comes back to what we spoke about at the start. There's 3 dimensions to breathing. It's not just about the biomechanics, you have also the biochemical and the psychophysiological.